Hi, my name is Jim Bergeron. I've been a resident in the UAE since 2009. I recently received an operation or a procedure from Dr. Mouhsen Al Hosein here at King's. The reason I was prompted to come to Dr. Al Hosein was because I was experiencing significant abdominal pain. This had actually lasted for approximately 2 years prior to me seeking medical assistance. Once I came, he immediately identified the problem, which was a hernia. During the procedure, Dr. Al Hosein actually identified a second hernia. He went ahead and repaired both hernias. I have to admit, the procedure was a huge success. My life has significantly changed since then. Prior to the procedure, I couldn't even walk more than 30 minutes in a mall before needing to take a break due to the pain I was experiencing. Now, here we are, more than 5-6 weeks after the procedure. Just a few days ago, I spent 3 hours shopping around in the mall, zero pain whatsoever. I'm extremely happy, and the procedure was a huge success. Dr. Al Hosein even followed up with me numerous times. I couldn't ask for more. My life has completely changed. Thank you very much, Dr. Al Hosein.
I've met Mr. Jimmy in the clinic. In that time, his complaint was pain and swelling in the abdomen, actually, in the belly button area, which is something very common. He noticed recently that he has this pain, especially if there is any exercise or if he is putting any effort or a pressure on the abdomen muscles. Clearly from the examination here, we call it umbilical hernia, which is a defect in the abdominal wall muscles. I explained to him, and we followed that with a radiology study by a simple ultrasound. We confirmed the diagnosis, then we discussed the result. I show him the defect, and we planned for the surgical treatment. If there is any hernia, the treatment of it, it's a surgical treatment. Simply, it's a defect, and we have to close it. We do that in a keyhole surgery. It's a laparoscopic treatment, which is definitely easier than the open technique for the patient himself as a post-op recovery. We fix the hernia, we support it with a mesh, we finished the surgery. He stayed like 1 night in the hospital. The follow-up after the surgery is really important as much as the surgical itself. The doctor should be in a close contact with the patients in such a cases. Definitely, if these cases are being treated earlier, it will be easier for the patients and the recovery will be faster. Usually, it takes from 2 to 4 weeks after the surgery. Then the patient, he will feel that he's completely fine and he backs to his normal life.